is Colleen Parsons, and this is Lecture 3A, General Assessment with Voiceover. Before we begin the inspection of a patient, we've actually accomplished already the general survey and the health history questions, so that the patient has already given you, the nurse, a significant amount of information. Then we have the patient disrobe, or at least be in a, we want to protect them for their privacy, so at least be in minimal amount of clothing. We inspect the patient, so we're looking at their hair, their skin, their face, their symmetry. Symmetry is very important in all things with health assessment. We're actually getting down on the patient's level and looking. And in the beginning, you will actually have to get down on the patient's level and look. After you get some experience, it won't be so obvious and awkward that you're actually moving down to see some things. When we're estimating age, let's assume that the person in the middle is the actual age of our patient. But you can see, and you've known people who look much younger than their chronological age or much older than their chronological age. What are some reasons why someone would look younger? Well, of course, genetics, their health, how they've been maintaining themselves. Perhaps they've had some surgical enhancement done. Perhaps they color their hair. We can alter aspects of our physical being to appear younger than we are. We can also, through cosmetics, alter our physical being to appear older than we are. However, when we look at the picture on the right, the patient on the right, we can see that perhaps genetics have come into, maybe she's aging more quickly than the average person because of genetics, but it is also likely that she may have undergone some significant and chronic health issues. Cancer treatment can affect how old people look. Having experienced a stroke or COPD or any chronic debilitating condition will physically alter our age. Our sexual development continues throughout a lifetime, but in the beginning, especially with adolescents, they can be very worried about how they are sexually developing. And there are guideposts. Jarvis talks about them at length. So there are guideposts that we can look at, but people don't always mature at the same rate for the same reasons. Either there's a lot of supposition that the hormones in meat, especially in chickens and beef, that are added to the meat as the chicken is growing before they're harvested, or as the beef is growing before it's harvested. So those growth hormones that have enhanced the growth and productivity of the meat market may be impacting the sexual development of our youth. With that, genetics also play a very important part. And it's not so much environmental, but you will see environmental sexual delay if people are sheltered a lot in their development. So you might not see physical development, delayed sexual development. I should probably say that better. But you will see emotional sexual developmental delay, if that makes sense to you. Level of consciousness. So you're looking at your patient. Now, if a patient, your student patients here will all be conscious. However, when you are in a hospital situation, your patient may be experiencing other levels of consciousness, such as lethargy. That's a very important word for you to learn, lethargy, be able to say it and know what it means. It means the patient is sleepy but arousable. So every time you go into the patient's room, their eyes are closed, they seem to be napping, but as soon as you say their name, they wake up easily. That's lethargy. Obtunded is when the patient is really asleep and cannot be fully aroused. You've seen patients, people, perhaps if they've been really, really tired and you try to wake them up, or perhaps if they've had too many adult beverages and they're sleeping, or perhaps if they have been under anesthesia. It can be even having a tooth extraction. They can have an obtunded sense for a while. So we're trying to get them out of that deep level of sleep, depressed consciousness. There is a Glasgow Coma Scale, which you should learn. You don't have to memorize it necessarily, but you really should learn it. And especially by the time you get to ICU, you should know this scale inside and out. Almost all healthcare organizations that I've worked for use the Glasgow scale. So you can see that when people are awake and alert, they are spontaneous, they are oriented time, place, and person, they obey commands, and we add those scores up to get at least a 15 if they are, well, that's the maximum score, if it's a 15. If they are, there is no response, no response, no response, no motor response, no verbal response, and we can't get them to open their eyes, that would be a 3, and that's totally unresponsive, and that's the lowest score they can get on the Glasgow scale. So you can look at this, see this, and begin to understand how we use not just subjective data by me saying, well, that patient won't wake up, but truly objective data, and here is one of the scales that will allow you to see objective data. Skin comes in all colors, so it is important to know what the baseline skin color is for your patients and to note it somewhere. If a deeper skin tone is suddenly pale, that might mean something different than if a pale person appears pale to you. Do you understand what I'm saying? So noting their skin color is part of our assessment. Facial shape and symmetry is really important, looking at individual aspects of each person's face. Their eyes, are both eyes the same? Do they open the same? Are they placed in a similar place on the face? Can they smile? Can they frown? Those take muscles, and if some of the muscles are impacted on one side of the face and there is a lack of motor control, that is a neurological problem, and that's important to note. Can they raise both eyebrows simultaneously? If not, again, that's a motor problem that's significant to note. We pay attention to all these things. Can they breathe when you occlude one side of the nostrils and the other side of the nostrils? Can they breathe easily through one nostril? Overall appearance. So when you look at the patient, the stick figure on the left, you can see that that patient seems to be running and is easily moving. If we had a patient come in and they were holding their abdomen and they might be walking a little hunched over and their face was grimacing, would we have a different understanding of what that patient is experiencing? Of course we would, and we would write that down, and then that would dictate what kind of focused assessment we were going to do with that patient. Now, whenever you do a focused assessment, you also need to do your full head-to-toe assessment. So the focus assessment might come first because that is what the patient is really complaining of, but you need to include everything, all aspects of the head-to-toe assessment with a focused assessment when you're working with a patient. Body structure, nutritional state, symmetry, posture, position, body build, all of those things need to be noted in a health assessment. You need to be able to give a very good picture of your patient from the ground floor, from the very first time you see them, so that we can compare, have they changed over time? So sample charting for healthy people is important, and we might do this in class where you look at one of your friends in class and actually write down all of these things. All of these things should be included in your initial note of a patient. So the general appearance, which is how they look to you. What does their skin look like? Is it damp? Is it dry? Is it, does it feel springy? Does it feel like they need fluid? So their skin, their age, their hygiene, are they clean? Are they malodorous, which means they smell bad? Are they, do they need a bath? Consider the patient's general appearance as far as tremors. Do they have tremors? Do they have any facial drooping? Does the patient appear close to his or her stated age, or do they appear older or younger than their stated age? Notice the color and the condition of their lips. Are their lips chapped, which might indicate a little bit of dehydration depending on the time of year? Are their fingernails chewed on? What do their fingernails look like? Are there any variations in color to their fingernails or their hands or throughout their skin? Are there any obvious lesions? Lesions or boo-boos of any sort? What is the general hygiene of the patient? We talked about that a second ago. Does a patient have a disheveled appearance? Are their clothes clean or are their clothes stained? Sometimes people only have one set of clothes, and so they might be able to shower, but they're putting dirty clothes back on. How is their breath? What does their breath smell like? All of those things will be included in your assessment, and you'll be learning those things as we go along. Do they have all of their teeth? And especially if it's a child, are the teeth loose? Is there evidence of poor oral hygiene? Do they have good oral hygiene, but maybe they haven't, sorry about that, or maybe they haven't been visiting the dentist. So here's a patient who is 53 years old, and I really want you to think for a few moments, how would you describe this patient? Take a minute and go ahead and write this down. Is this patient male or female? Is this patient older or younger than their stated age? What do you think is going on with this patient? Is this patient just napping, or are they in a deeper state of consciousness, unconsciousness? Mobility. Can this patient move easily, or are there some restrictions in people's movement? So we're looking at the gait. You can tell as somebody walks in, or sometimes when you're in the doctor's office, they have you walk across the room. You're really watching how people move. Do they need an appliance to help them move, like a walker or a cane? Do they hold on to the furniture when they're getting up or when they're walking across the room? Behavior. How are they behaving? What is their facial expression? What is their mood, their affect, their speech pattern? Are they slow and is it hard to hear them? Or are they talking loud and fast? What's going on for them? How are they dressed? What is their personal hygiene? Basic questions you would go through for your general survey, and they include all of the things that we just talked about. We're really looking at the physical appearance, the body structure of the person, their mobility, and their behavior. And that's all for now.